Medicare Trustees Report Summary. Let's dive into the who, what, when, where, and why. This is Mike Hitcho, owner of Hitcho Insurance Agency. This is a very important summary that comes out every year. Let's dive into the who, and this is basically a Medicare Board of Trustees that was created to look into the financial health of Medicare Part A, hospital insurance, and Medicare Part B and Part D. We're talking about the sustainability of the programs. The board is intended to have 6 members: the treasurer, labor, Health and Human Services Secretary, and the Social Security Commissioner, along with 2 public trustees. Ironically, those seats have been vacant since 2008 for some reason. What's this about? Again, this is a 250-page report going into talking about Part A and Part B and D. It's released usually in early May. You can find the full report at CMS's website. That's the Center for Medicaid Services. And why is this out? Let's keep it simple, all right? In 2023, there are 66 million Americans on Medicare insurance. Total cost about $1 trillion. So we need to find out where all this money is going and how long Medicare is going to last. So we're going to dive into Part A, hospital insurance. The short-term outlook, thumbs up. Thumbs up, we're doing fine. It is expected to last at least until 2031 as of last year. Good news this year, 2024, it's extended to 2036. So we got an extra 5 years all of a sudden of Medicare hospitalization sticking around. But for the long term, thumbs down, big thumbs down. If it goes away in 2036, what's going to happen? Not having hospital insurance coverage. So the report makes a few suggestions, okay? One thing is to raise payroll taxes immediately, anywhere from 12 to 40%, again, effective immediately, which isn't taking place anytime soon. And also to have a reduction of expenditures, anywhere from 8 to 22%, could really help add on additional years. So the government is taking kind of an approach of looking at getting costs for services down over time. But how much further can they go before there's too much of a strain and we're not getting good doctors in hospitals because there's no money from Medicare to go towards the services for individuals. So it's being monitored. How about Part B and Part D? Okay, well, that's expected to continue on indefinitely. That's great news. But right now, the cost of Medicare Part B and the average cost of Part D, you might be paying a little less. You might be paying a little bit more. I don't know, but the average cost of those 2 items is roughly about 11% of someone's Social Security total. Okay, we're looking at the average of Social Security. So for some people, it's going to be a little bit of a higher percentage. For some people, it's going to be a lower percentage. But on average, about 11% of your Social Security is going to pay just for the premiums of Part B and Part D. All right, that's today, 2024. Now, projected all the way out into the future. And I know you're not thinking this long range, neither am I, because we're not going to be here in 2098. But in 2098, it's projected to be about 17% of the cost of somebody's Social Security. So as time goes on, the cost is going to continue to rise with inflation and put less money in your paycheck to go grocery shopping, to put money into the economy. So the Board of Trustees is looking over this. They're providing this information to Congress. Politicians, there's no politician anywhere that's going to want to see their tombstone says Medicare failed on my dime. Okay, you're not going to get elected that way. So there's no one out there that's going to say, hey, I'm going to put myself out there and let that happen. So another way really to help save money, though, is to make sure that all the additional coverage that you get to protect against the deductibles and co-pays and co-insurance left behind by Medicare Part A, by Part B, by having Part D coverage, all right, is to have a broker who is licensed with all these companies, all the popular ones, get you the best deal based off your situation. Better yet, have even educated you on Medicare first and explain what all the differences are. So if you're not working with a brokerage or a broker or an agency like that, definitely give us a call. Even if you are, you still should give us a call. Make sure you have the right plan. You're saving the most. You're getting the most benefits. Again, Mike Hitcho, insurance agency owner of Hitcho Insurance. We look forward to chatting with you in the future. Take care.